methods? Like when I was looking it up on the internet, like there were some burns. They had been burned because people had done cupping, but I think the person wasn't an expert or something like that.
Yeah, I mean, obviously, for anyone to be practicing any medicine on any patient, they should be very proficient in this. Burns can occur, for example, if the cup is left on too long and it's too strong a vacuum. This can cause a temporary burn to the area, and that would take an increased period of time of healing, and may even leave some slight scarring in the area. So again, an advice to anyone going for this treatment is to go to an individual that is very proficient and experienced in the hijama. Yeah.
Okay, inshallah, we're going to go for a break, and we'll be right back. Don't go away.
Back to the Prophet. Join Sheikh Ammar in the program Back to the Prophet, wherein he teaches us practical lessons from the Prophet's life and how this can help us to overcome our challenges in the present.
We talk about the life example of the Prophet Muhammad, peace and blessings be upon him, seeking guidance for ourselves. In the early days after the revelation of the Holy Quran, the Muslims were greatly persecuted, so much so that quite a few Muslims had to leave Arabia and migrate to Africa to live among Ahl Kitab, Christian people who followed the gospel of Christ.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for staying with us. Joining us in the studio to talk about cupping is Dr. Tamer Sha'ban. He is a medical doctor and a researcher at the University of Cairo, and he's also the vice chair of the International Cupping Society. Assalamu alaikum wa rahmatullah.
Alaikum salam wa rahmatullah wa barakatuh.
And the first question I want to ask you is, what is the history behind cupping?
Cupping therapy is dated back from thousands of years. The first do cupping is the ancient Egyptians. The first book written in medicine, Ebers Papers, is the first book who mentioned cupping. Cupping, we have a slide there. There is a tomb with cupping glasses in front of this tomb. Then ancient Egyptians passed this modality to Greeks. Chinese take this modality and they practice this, then get all over the world. There is then when Rasulullah sallallahu alaihi wasallam come and do cupping therapy and tell us to do cupping therapy, this survives this ancient method of healing.
Okay, what is the evidence behind cupping exactly?
Yes, cupping, there is a new science, is evidence-based medicine. This evidence-based medicine, we make trial about something we can't see.
Yes.
We can't know its mechanism and see the results. When we see good results, this is evidence for this modality. Cupping, there is many researches about cupping therapy. In Egypt, as example, there is a doctoral thesis about the effect of cupping therapy for diabetes and for rheumatoid arthritis, and they get a very good results in this trial. There is another study about cupping therapy for lower back pain. This is give very good results.
And I understand you also have your own research paper about asthmatic children and the benefits of cupping for them.
This study is about the role of cupping therapy as a complementary medicine for on the pulmonary functions and the quality of life of asthmatic children. I do cupping therapy for 30 children. as a treatment group, and there is another 30 children as a control group who take only drugs. My treatment group take cupping therapy and drugs.
And drugs.
And in the final of the study, we find that there is a significant results, positive results from cupping on other group. My group, which I treated with cupping, get a high quality of life. They go to their schools regularly. They don't have any acute attacks during this study. They get higher pulmonary functions than other group.
So that's exactly what the difference was. So what were the specific differences as a whole for the different groups? Like how did the ones who use cupping, how did they benefit more from the
in this study, I think about design a program for every family. Asthma is very, very, very bad disease.
Yeah.
And when the asthma is in the child, prevent him from playing, from going to school. And in my intent, I intend to design a program which we can teach this method for a father or a mother. This method which I used is a flash cupping therapy. We can very quick applying and removing of cups on certain points. When father or mother can easily learn this procedure and do this for her or his children, this will be very beneficial for them. When I start this study, I actually afraid from not participating from mothers and fathers for this
maybe
study.
they'd be too scared or something.
Yes, yes. After one session, they ask for me to do the whole course of cupping. The course is 10 sessions, 2 per week, for 5 weeks. After from the first week, they see the difference on the child.
Okay. I also have a question for you, Dr. Munir. The mechanisms of cupping. I understand we also have a slide about this, and you can both add things to it. The mechanisms of cupping.
In terms of the
actual, like you spoke about flash cupping. What are the different mechanisms throughout history also?
The mechanisms of cupping therapy, there is different theories about cupping therapy. There is many studies to show what actually the mechanism of cupping therapy. One of them is the Bain Gate theory. There is a theory that said there is a pain channels in the body.
Yeah.
Transmit signals from the painful area to the brain. Cupping will prevent these signals from reaching the brain, then the pain go away. The next is prostaglandins theory. Prostaglandins theory is prostaglandins are products of inflammation in the body. When we take these products outside the body, the inflammation will cure. Other series, there is more acceptable series, nitric oxide theory. Nitric oxide is a gas which produced in the body by the wall of the arteries and veins. This nitric oxide causes vasodilation of the body, increase the circulation, prevent thrombosis of the blood. Some studies showed that when we do cupping, this gas released in the body. Another theory is endorphin and enkephalin theory. Endorphin and enkephalin are physiological pleasure substances which produced from our brains. These substances, there is a theory that the brain produces these substances after cupping, and this will
So it
make us
releases
so-
these certain chemicals in
and
your
this
body.
is what we feel after cupping. We are happy and we are
Revived,
in good.
renewed.
Yes. The Chinese medicine theory is the channels, energy channels theory. There is a 14 channel in the body, all over the body. This channel have each points in every channel, and by stimulation certain points we produce some effects such as acupuncture theory. There is a very popular research published in the Journal of Biomechanics in 2005 by the researcher Sam. He said that cupping can stimulate acupuncture points, and any acupuncture, any evidence that proves that acupuncture can cure anything or can treat any disease, this apply to cupping. And he replied to some of of USA societies such as Cancer Society said that cupping have no evidence, but acupuncture has evidence. He replied to this word by this research. Cupping can stimulate more than acupuncture in any disease.
Okay, there is a hadith, Dr. Munir, that says you can't do cupping on certain days. Do you know anything about this? What is your opinion on that?
Yeah, in Ibn Qayyim al-Jawzi, in Tib al-Nabwi, the medicine of the Prophet ﷺ, he mentions in the Arabic these various hadiths, many relating to the hijam and cupping, and he also gives a tafsir of these hadiths. Unfortunately, in the English translation, they've left out some very important points. So the one that mentions specifically about it is forbidden to do on this specifically mentions Wednesday and Friday, that these are actually weak hadith. And he even mentions that the one who had narrated the hadith, huwa kadhib, he was actually a liar of this in translation of hadith. So we need to be very careful of this, because unfortunately, because of this miscommunication from the translation, many people are staying away from hijama from Wednesday. But as we mentioned earlier on, that hijama ideally, to get the best benefit, can be done on the 17th, 19th and 21st of the lunar month. Inevitably, there will be days where a Wednesday and Friday fall on these. So these are not contradicting each other. It's rather there's a weak hadith. And even Allah subhanahu wa ta'ala, that He created on Yawm al-Arba, on the Wednesday, He created light. So again, this is the reason we do this. And Imam Malik, he also had hijama done on these specific days himself, to show people that it's not forbidden to do hijama, can be done on any day of the week.
Because there's good in it, why would it be said
Sahih,
that you
Sahih.
can't do it on a certain day? What are the types of cupping? There are different categories.
Okay. Many people know that cupping have only 2 types.
Yeah.
But actually, there is 11 types of cupping therapy. The first is according to the pressure applied to the cups, light cupping therapy, medium cupping therapy, strong cupping therapy. There is a massage cupping therapy. There is also needle cupping therapy. They apply needle before applying cups. There is a herbal cupping therapy. Put some types of Chinese herbs before applying cups, because cups increase the circulation in this area, and this can get more
So
get
the herbs-
enhanced actions
do the
for
herbs-
these herbs.
The herbs circulate in the blood?
Yes,
Okay.
yes.
Okay, so can you just explain, like, you said, like, specifically, like, the types of small, like you said, what does that involve, the weaker cupping?
Weak cupping therapy is for children and for old people. we can use cupping therapy and medium cupping therapy. There is a special cups for that for children, rubber cups, self-squeezed cups, and when we do cupping with these cups, there is a medium or a weak suction produced. Strong cupping is for adult people for some pains. Massage cupping therapy to treat large areas, to treat muscle spasms. Needle cupping therapy used in some cases which when we need to stimulate certain points and stimulate the around area. In some research, we don't need to put needles in, we put the cups, because we just by applying the cups we stimulate these points actually, and the needle is very small to apply, but the cup is large, then stimulate this point and the point around it.
So Dr. Tamer, what for a person who has no ailment, he just wants to try out cupping just because it's a tradition of the Prophet, what do you recommend for him to do? What kind of cupping?
Cupping as a treatment can be used as a treatment and can be used as a preventive from diseases. We can do cupping for preventive medicine. I recommend go to a good cupping therapist. Recommend choose the best days from Sunnah, as we say 17th and 19th. Choose the right time to go is the early morning to go to have a good cupping session for preventive.
Was that because of before a meal or after a meal?
We recommend who will go to cupping not to eat 2 hours before cupping session.
Oh, okay.
Yes.
So what's the reason for that, not to eat?
Because some afraid from this we can vomit or can.
Oh, okay. Yes. So is there any pain that involves cupping, like when it's because you said you might vomit or anything? Is there any pain that you get from it?
No, I mean the incisions are very small, and when you apply the cup to the area with a vacuum, it actually creates something called a partial anesthesia. So it sort of numbs the area. But obviously different areas of the body, some areas are more sensitive than the other, and the patient may feel these little scratches. So that is something to, again, the patient, for them to be aware of that. But in the light of things, if you think of the benefit that you're going to gain, they say sometimes in the West we say no pain, no gain.
Yes, yes.
So it's a very small amount, light scratches, like paper cuts, and then to gain the benefit from that.
This is a small surgery.
Yeah, it's not.
Surgery you must fast for.
Yes. Okay, that's all the time we have for this segment. We'll be back after a short commercial break. I hope to see you guys back.